Well, good morning, everyone. Uh, Welcome to Learning to Cope with Compassion Fatigue, the EMS Perspective, presented by Lori Karabinchak and hosted by myself, Flamm. This program is presented by the Penn State Public Health Preparedness Program. So I'd like to introduce our speaker, Ms. Lori Karabinchak. Lori is an expert on compassion fatigue. She has conducted research in the topic, has presented on the topic at local, regional, and national conferences. She's a health educator and risk communicator, and also the Medical Reserve Corps MRC coordinator for Middlesex County, New Jersey. And she is also a Penn State University Public Health Preparedness Program soon-to-be graduate in the next few days. Congratulations for that.
Thank you.
I'd like to introduce myself. My name is Flamm. I'm a physician, paramedic. I'm the medical director for Lifeline Critical Care Transport. I'm an emergency physician at Penn State Hershey Medical Center. I'm also a medical team manager for FEMA Pennsylvania Task Force 1. And I teach at Penn State University Public Health Preparedness Program. I teach about public health preparedness, healthcare preparedness, and research topics. So a little bit about the context for this lecture. I first learned about compassion fatigue when I was teaching a class that Lori was one of the students, and she was writing a research paper on the topic. And as a EMS medical director, I thought I was really intrigued by compassion fatigue. Before that, I heard about burnout, sometimes in a not so positive context, kind of a blaming context. So when I heard about compassion fatigue, it really got my attention, and I was really interested in the topic. And as I watched Lori work on her research project, I became even more interested, and I really saw the context and how it would fit in with EMS and how important it is for EMS. So that's kind of how I got interested in the topic. And Lori, how did you get interested in the topic?
Well, we all have a story. I do have a story about how I ended up coming with this topic, with this program. That is something that we will be touching base later on. But for the most part, I felt that this was something that was very crucial and critical for any first responder to start learning about, especially since it happened to myself, which again, we will touch base and learn about later on. But for the meantime, I would like to help you start learning about compassion fatigue and how to get through it.
I'm curious to hear your story.
Yeah. So for this course, we do have some learning objectives. So first responders, especially such as EMS, will be learning how to define compassion fatigue, learn how to identify the signs of compassion fatigue, and different ways on how to cope with compassion fatigue. So I always like to get started, and I always like to ask, does anyone know what the definition of compassion fatigue is?
Well, I know what compassion is, and with time, when I started out my practice, I had a lot of compassion, and I felt really strongly about helping people. And then over time, I kind of got, worn down. It's like the same stuff again and again, the same calls for chest pain, the same car accidents. So I guess it's kind of getting fatigued with dealing with that kind of stuff on the everyday basis.
Okay. And you also mentioned it previously that you hadn't heard about compassion fatigue. You were more familiar with the word burnout. So yes. What would be your definition for burnout?
Well, burnout, when I think of burnout, I think I just can't deal with this job anymore. It's like, oh, another call with an elderly fall on a blood thinner, or another patient that I have a lot of trouble carrying down multiple flights of stairs. And for me, burnout is when I get that call and I'm like, I just can't do this. I can't deal with this anymore.
Right. So what would you say would be your biggest factor, the difference between the two of compassion fatigue and burnout?
Maybe as it relates to, maybe burnout would be related to my job and compassion fatigue would be related to me and how I feel.
Great. That is exactly what it is. Compassion fatigue is also known as vicarious trauma, which refers to the negative emotions that individuals feel from helping others at work. So being in the EMS field, just like you said, how you would get another phone call about chest pains for this person or a car accident with another individual. Whereas burnout is also known as occupation burnout, or the psychological term referring to general exhaustion and the lack of interest or motivation regarding one's work. The two really do go hand in hand with each other. It all just depends on, which one is more overcoming than the other. So compassion fatigue originates from dealing with victims of trauma, and burnout originates from the occupational stress of being overworked. So especially in this COVID-19 pandemic, we were hit with both, and especially EMS, you were hit with both hard. Like you were working, I'm assuming you would be working very long shifts. On top of that, you also have to deal with all these patients. And in the back of your mind, you're thinking, am I wearing the right PPE? Am I going to bring it home to my family? Am I protecting myself? Am I making sure that I'm hand sanitized in between patients? I can only imagine what it was like for you guys over there. I mean, I'm working from a health department perspective, and it was crazy, but I could only imagine what it was like in a hospital.
Yeah, I mean, there was a lot of stress around COVID, and things just kept on changing. At first it was like, do we treat COVID like Ebola? I mean, what kind of PPE do we need? Do we need, closed breathing apparatuses? Do we need N95s? Is it even safe to transport a COVID patient in the ambulance and be next to them for half an hour during a transport? And no one knew the answer, and that's very stressful.
Yep. Do you have to decon after this patient after they've transported
starting to clean everything out, and the information kept changing too. One day you hear one thing, and then the next day it's like completely the opposite, and then it goes back to the first thing, and you don't know who to trust. You don't know what information is right or wrong. You don't know if any information is right. That's a very stressful kind of situation to be in. Exactly. The workload is higher, and quite frankly, that never went away. The workload is still really high. We can barely get through the shift and finish all what we need to do.
Exactly, I'm right there with you. Another definition that I actually had for compassion fatigue was the physical and mental exhaustion and emotional withdrawal experienced by those who care for sick or traumatized people over an extended period of time. And I did feel that that actually matched perfectly with the COVID-19 response, considering it has been over 2 years now that we have been in this response of nonstop, masking and hand sanitizing, testing, having a special COVID unit and things like that. And I could only imagine, I mean, I know from my side, I had to actually do some stories where I had to do contact tracing. So I did get to hear some more in-depth stories about an individual or their family, how they lost loved ones. Some of the interviews were actually happening right while they were in the hospital, and it was quite traumatizing, some of them. And I know I have plenty of stories that have stuck with me, and if anything, we'll get into those a little bit later on as well.
Yeah.
So this next portion is a self-assessment for compassion fatigue. So there is just a small little quick list here, and this is something that I always ask everyone to kind of just take for themselves. So I can go through them, I'll read them, and if it's something that you're going to say yes to, just make a little tick next to it, just so you can review it after I'm done reading through these. So the first one would be personal concerns commonly intrude on my professional role. My colleagues seem to lack understanding. I find even small changes enormously draining. I can't seem to recover quickly after association with trauma. Association with trauma affects me very deeply. My patient's stress affects me deeply. I have lost my sense of hopefulness.
Mhm.
I feel vulnerable all the time. And the last one is I feel overwhelmed by unfinished personal business. So for the most part, with just this really quick assessment, if you've checked yes to 3 or more of these, there's a very good chance that you are experiencing compassion fatigue in one way or another.
What if I checked yes to all of them?
Oh, then compassion fatigue is right there for you.
Okay.
I know when I first did this, I said yes to every single one. I just made a very big circle. I was like, this is me. This is all me.
Yeah.
So it's always nice to know that you aren't alone, especially knowing when it comes down to this topic of compassion fatigue. So don't worry, you're not alone in this one.
Yeah.
So this next part, I'm going to be asking if you've ever experienced some particular symptoms, which I can already tell you. And this is going to be any one of these symptoms from any part of this response to your COVID-19 response. So it could be at the very beginning, it could be at the middle, it can be currently, anytime during this response. Have you experienced one of these symptoms, or if not all of them, because I've experienced every single one of them at this point. So if you've experienced it, you could just say yes, you could just go, hey, that's me.
Okay.
So have you experienced anger? Me too. Blaming. Now this one's always a very tricky one because from my standpoint, being that I'm like the underling of the county, I would be blaming like my supervisor for not giving me more time, or I blame my director for not getting certain things approved. I've heard from the public standpoint that they've been blaming the state, or the state's blaming the feds because they're keeping things from them, or people are blaming the CDC and the state because they're not getting their facts right at the same time. And then it was just, everything was just going head to head. So a lot of the time people do end up getting confused about the blaming one. So I did just want to go a little bit more in depth about that.
Yeah, I mean, I think I blame myself for a lot of what goes wrong for me, but then
Yeah.
I also blame everyone else. So both.
Yeah, exactly. I feel like this one hits hard with everyone, but depression.
Mhm.
I
Yeah,
also
sometimes
feel,
it's just depressing.
oh yeah, even for those that weren't working, people that were forced to stay at home, I know that this was something that hit hard for them as well.
Yeah.
Exhaustion, both physical or emotional. And I feel like we hit both of those.
Oh yeah.
Frequent headaches. It
I
got
know
to
a lot of I know a lot of people get headaches.
Oh yeah, I got to a point where every morning I would wake up and the first thing that would happen is I would get a headache. And it would make me not want to go to work because I would be trying to do anything to not have a headache.
Mm-hmm.
Sleep disturbances, and this is probably one of my favorite pictures because I know I couldn't sleep because I was thinking about everything on here, which is stress, PPE, overtime, COVID in general, and what the new guidelines are going to be tomorrow. Family, if they're safe, if they've contracted it, what's going to happen to them if they do end up getting it. Symptoms, because this was also when symptoms were changing sporadically. It started off with just 3 symptoms, and now we had a whole list of symptoms that were asymptomatic. Social distancing, you could even throw masking onto that. So I know I am fully aware that I barely got any sleep throughout the entire COVID-19 pandemic response.
Yeah, there's just a lot to think about, and it's hard to
yeah.
sleep when you have so many different things on your mind.
And then my other favorite one is workaholism. I felt like this really hit home, especially for me, and I can only imagine for you. I know that I would be working from 8:30 in the morning until 9:30 at night, to then drive home, to then open up my laptop and start working from 10 at night until 3 a.m., to then have to, figure out what am I going to do? What's my plan for the next day? So that got very stressful.
Oh yeah, I can't stop working. I mean, I do my shifts. I'm just on my computer doing other work, doing my charting. I just can't stop working.
Exactly. So that was one of my favorites. Now, some additional warning signs of compassion fatigue would include these, which would be abusing drugs, alcohol, or food. I know one of the common things that people started talking about was getting the COVID pandemic pounds. I know for myself, that was definitely there. I know I'm a huge stress eater, and I just took straight to food when it came down to coping with all of my stresses, especially about the pandemic. Chronic
it's hard to eat healthy when there's a lot on your mind. It's just like I eat the first thing I can find that tastes good.
Exactly. But then you also have to understand a lot of these places were also closed. Any of your favorite places were closed, or they were very limited. You had fast food restaurants where you can just go through a drive-through and get right back to work.
Yep.
Chronic lateness. A diminished sense of personal accomplishment. I know for myself, at the end of every single day, I always felt like I could have done more. I felt like I never achieved everything that I wanted to do within that day. I always felt like the next day, I was just dreading because I had so much more that I had to do, and I already felt like I was behind. Gastrointestinal complaints, having an upset stomach, that was something that would always get to me. High self-expectations, which I was right there. I always wanted to do more, even when I couldn't do more. I was doing the maximum that I could, but I always wanted to do more than that.
Yeah. And a lot of us are very high, high achieving people. We're in EMS for a reason, and we just want to go beyond. We want to go do the extra. And it's a cycle.
Yep. Hopelessness, which I feel like that probably hit the most when things started to go down for COVID, the responses, but then they peaked all over again. And it was like, we were in our next wave and we were just like, oh no, here we go again. Like, I just couldn't do it. I know for myself, I was mentally checked out. Again, working in a hospital, I can only imagine what it was like.
Yeah, it's like, are you kidding me? Another wave? I thought we were done with this.
Exactly.
So, yeah.
Hypertension. I feel like everyone's blood pressure during this response has been way up there because this is just high stress all the time. Less ability to feel joy, and low self-esteem. I know when I did this presentation with some of my coworkers, they didn't know what joy was. They forgot all about it. They didn't have anything that put a smile on their face when it could have been the smallest thing in the world. So when that ended up happening and they started telling me about that, that was kind of where I was like, oh no, we need to.
I mean, a lot of the things that we like doing are gone. I mean, we can't, a lot of the travel was gone through COVID, shows, concerts, social gathering, like everything people like doing is just taken away. So yeah, it's hard to find or feel joy.
Exactly. So working in a hospital settings, EMS leaders such as yourself should consider some organizational compassion fatigue when considering the root causes of it. So these are actually just a couple of examples of things that you would want to be looking out for. If someone starts showing the inability for teams to work well together, there's a good chance that that individual might start experiencing some type of compassion fatigue. The desire among staff members to break company rules, there's rules for a reason. They're not meant to be broken, especially when you are an EMS personnel or you're working in a hospital. If someone is going above and just doing it, that's kind of someone that you would want to ring in and have a sit down and say, what's going on? There's definitely something more to this. This is out of your character, especially for the outbreaks of aggressive behaviors among staff. That's also going right back to the symptoms of having anger. I know for myself, I ended up having a couple of moments where I would just snap at people. I didn't mean it. I was just so angry. I was angry at the entire pandemic. I was angry at the situation. I was angry at how things are being handled. The inability of staff to respect and meet deadlines is just kind of another thing that you would want to keep an eye on, especially if it's out of their character. Their lack of flexibility among staff members, EMS is working as a team. There is no I in team, as they would always say. You need to work together. The inability of staff to believe improvement is possible. I know even from a health department perspective, that is something that during this pandemic, everyone is completely under that impression that, nope, that's it. It's a done deal. We're set in our ways. There is no way to improve it. However, I'm in the process of conducting a SWOT analysis with the state and throughout our entire county and everybody who responded to this pandemic. And it's our way of trying to alter everything and make improvements on how we responded to this. If a pandemic were to ever happen again, which I'm going to knock on wood and hope that it never does.
Hopefully.
And the last one would be a lack of a vision for the future. Again, for myself, I just felt like once we were in this pandemic, that was it. There was no going anywhere else. That this was our future, was this pandemic, and we were just going to be set in our ways. That we were forever going to be wearing masks. We're forever going to have to be getting tested. We're forever going to have to be 6 feet apart. And it almost felt as if, every family gathering was going to have to be like at a 6-foot pole away from everybody. And I've had a lot of family that did end up getting severely sick, and I felt really horrible about it, especially, I was on the front line, so I definitely couldn't see them. But things have finally started to clear up a little bit. I'm finally able to see my family again. So I could say for myself that I do see a future now.
Yeah, I mean, what you're describing sounds to me a little bit of like learned helplessness, and kind of getting out of that state of mind of learned helplessness.
Oh, absolutely. So is time the enemy? This is always a great question. To those who are in the throes of compassion fatigue, time, or more precisely, the lack of it, is the enemy. To compensate, many physicians try to do several things at once, like eat lunch while taking chart notes and returning phone calls, which I can say that I totally ate my lunch and worked at the exact same time, so I'm very guilty of this. And to make more time, they tend to eliminate the things that would help them revitalize themselves, such as regular exercise, interests outside of medicine, relaxed meals where you are disconnected from work, which I felt like during this pandemic, none of us would ever do that.
Mm-hmm.
Time with friends and family, which I know during this pandemic, we all felt was taken away from us. Prayer, meditation. At this point, we would find it the easiest to blame others. If only, if only we had enough time, if only there was more time in the day for me to do all of this work, so the next day I can feel just a little bit less stressed. But no matter how much or how well they would sleep, you would still wake up and feel exhausted, which is something I know that was me. Was it you during this pandemic?
Absolutely.
You felt there just wasn't enough time throughout the day to get all of your work together?
I need a few more hours every day. I just can't get done what I need. And I keep on rolling stuff that I wanted to do today. I keep saying, okay, I guess I'm going to have to do it tomorrow. And then again, I keep on rolling stuff forward and I can't get what I want done.
But what about your lunches? Would you eat your lunch in front of your computer? Would you be doing work while you were having lunch?
Well, that's even assuming I eat lunch. Sometimes I'm so busy, I skip meals. I'm busy seeing patients. I'm running between different things, and suddenly my shift's done and I never ate. If I'm lucky enough to have the opportunity to eat lunch while I'm working, it's usually while I'm looking at charts and I'm on the computer the entire time. I probably have a few people come talking to me while I'm eating. So I'm looking at the chart, talking to someone, and trying to eat at the same time. And I eat really fast because I know that if I don't eat my food really, really fast, there's going to be another cold or a trauma or a stroke that comes in and I'm going to have to leave my food.
Exactly. So we actually had a colleague here, and she's still here, and she takes afternoon walks very, very seriously. And even throughout this pandemic, she felt that, she had to take her walks no matter what. It would give her that time, just a couple of minutes to just get out of this situation, get out of the work environment, and, clear her head. It's almost like a little bit of a de-stressing. And she ended up coming to our office right now, which we are currently in Piscataway. We were all so used to not taking lunches that when we would see her take a lunch, we would all get annoyed because we're just like, oh, now we have to pick up her slack. Now we have to do all of this work. I wish I had the time where I can go take a walk. Oh, she doesn't have that much work to do if she's able to go for a walk and things like that. She ended up telling us that we made it feel like we didn't have to say anything to her, but we made it feel that if you took a lunch or you took a walk, that it was like a shame on you moment. And she stuck with it regardless of how we didn't say anything. It was just like how we were like, that was just the persona that was coming off of us of like, no, we have to work. It's work, 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 work. There is no such thing as a break. It's work, work, work. And it wasn't until after like things started to lighten up that I actually got to talking to her, and she was just like, you guys intimidated me. I almost broke. I almost said I can't take lunch because I have to be there for my coworkers, and you guys scared me. And it turned out, I mean, she was also hit with compassion fatigue, but hers wasn't as severe because she was allowing herself to have that nice break. I mean, don't get me wrong, a lot of the stories that we have been hearing since she was doing social support, her stories were a lot worse than some of the stuff that I was dealing with working at the testing sites or calling people with the results. But we both had our roles. She ended up being able to have some type of a mental break away from the work because that's just how she was set. I was never taught that. I was always taught work, 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 no matter what, especially during this pandemic. That's all it was. So I never gave myself that time. But there's always hope. There's always light at the end of the tunnel. Overcoming compassion fatigue means coming to terms with that anger, that fear, and that self-doubt that we have suppressed. Especially all of us have suppressed it at this point. This requires an honest self-reflection, a process that you might find quite painful. Yet, if you're compassion fatigue, getting back in touch with yourself is perhaps the most important steps in the recovery process. Without it, the lifestyle changes you're trying to make may not be enough to sustain you. Now, this is the slide that hits the hardest for me. This is actually how I ended up becoming compassion fatigue, realizing that I'm compassion fatigue, and how this program ended up becoming born. It was probably March of last year where I was a solid year or so into the pandemic response. And I had been working 90-hour weeks. I had been working 7 days a week. I didn't have time off. It was all day, every day work. I didn't even have enough time to do anything at home because if I wasn't at home on my laptop doing work or making phone calls or scheduling volunteers or vetting volunteers or working at a testing site or doing logistics or one of the like a million different things, I was sleeping for probably a solid 2 to 3 hours a day to do it all over again the next day. And needless to say, I had hit a breaking point where I just crumbled. And what ended up happening was I realized that I couldn't go any further. And we're talking, I was a very severe case where I ended up going to see a psychiatrist, and they diagnosed me with having some pretty severe depression and anxiety from working as much as I was. My symptoms were all there. It got to a point where they actually had forced me to take a step back from school. They forced me to take a step back from work for a solid week so I can kind of do a nice reset. I can tell you right now, day one of that I was not okay in any capacity. I had full-fledged anxiety attacks and panic attacks that I'm letting my school down. I'm letting my job down, that I wasn't there for the people that needed me, that I was just a failure, I felt like. And it wasn't until a couple of days after that I started realizing, I can't be the best version of myself to help everybody else unless I'm starting to put myself first too. one of the famous lines that we always say, especially when you're on an airplane, is you have to put your oxygen mask on first before you help others. You have to help yourself before you can even say that you can help others. So that was a really hard pill for me to swallow. But, going now a year later, this course was born because I realized, if I was able to hit rock bottom like this and as quickly as I did, there is no doubt about it that my colleagues are probably feeling the exact same way that I felt. Any other first responder who has been in this pandemic response for as long as we have, which working in a hospital, perfect example right there, you're definitely feeling it. I can only, your shifts are so much longer than even our work hours. So, and now you have to factor in COVID-19, PPE, wearing a mask. Does this patient have it? Does this patient have it? Am I the one that's going to be carrying it over? Am I the one that's accidentally contracting it because they were negative one day, but it turns out they're really positive the next day? You just have all these things running through your mind, but at the end of the day, you always have to put yourself first. If things are becoming too much, you have to take a step back. So it's kind of where this whole develop your own self-care plan comes into play. Now, everybody's self-care plan is going to be different from the other. So my self-care plan is going to be different from your self-care plan, which is going to be different from your colleague's self-care plan, et cetera, et cetera. Now, a lot of people don't really realize how in-depth a self-care plan can get, but it always starts with baby steps. So these are actually just a couple of tips, some self-care tips that I do always encourage people to look at, especially when making a self-care plan. So I'm just going to read the bolded parts of them. So self-care means taking the time to do things that you enjoy. So what would be something that you enjoy that once the pandemic hit was just gone?
Traveling. I love traveling. I like going places, and the pandemic just put a stop to that.
Yep, that was a huge one, especially coming from me. That's all I would do every other weekend. I would try to get out and just relax. It was that nice little area where you can just be in a happy place. Self-care also means taking care of yourself. Traveling would be doing that because that would be your way of removing yourself from the work environment. Making self-care a priority. The pandemic made that very, very hard to do. As we just stated, traveling out of the question, there goes something that you enjoy, and there goes taking care of yourself. That's three right there that the pandemic already took away.
Yeah.
Set specific self-care goals. So what that one would kind of mean is, if you can't travel, what would be a backup plan for you?
Maybe go to local places, go instead of flying somewhere or going out of the country, maybe traveling locally or places I can drive to.
Great, exactly. Now, make self-care a habit. I feel like this is something that is very, very hard for people, especially when they're just getting into it. So we always like to say to set small goals. So if you wanted to travel somewhere that you enjoyed because you weren't able to go flying, how often would you try to do that? Would you try going about once a week? Would you try going on the weekends?
Yeah, I mean, it's tough with working shifts. I have shifts on the weekends. I have shifts during the day. It's tough to find time. I mean, that's part of it.
Yep. That's also where self-care or set boundaries to protect your self-care. So one of my boundaries that I ended up having to set for myself was I realized that I was always bringing my work home with me. So I would be working from 8:30 in the morning till 9:30 at night. That's just me at my job. The second I would come home, I would open up my laptop. I would be on my work phone from 10 p.m. until 3 o'clock in the morning, sending emails, setting schedules. So my boundary was that I had to start leaving work at the door. I wasn't supposed to, and I wasn't allowed to bring work into my house. It was work stayed at work and home was for me. That became very, very difficult. And I had to start forcing myself to leave my laptop at work or leaving my laptop in my car, leaving my work phone somewhere hidden so I didn't have the even want to look at it. But that was something that I had to start doing. So you always have to know that you have to put yourself first. A few minutes of self-care is better than no self-care. Even if you aren't able to travel because of your shift work, try taking a walk, even if it's a 10-minute walk. At least you're being able to go outside, you're decompressing a little bit, listen to a podcast, listen to some music, listen to anything, or just listen to nature in itself. Even if it's just going to a park and just sitting there, it's something. Unhealthy activities don't count as self-care. This is obviously where the overeating would be coming in. We want to start shedding off those pandemic pounds that we ended up getting for well over 2 years. I know I started that super long process, and it is not as fun and easy to take them off as it was to putting them on.
Yeah, and just to put it out there, alcohol, substance use,
Yep.
is something that does happen in EMS, and it's a struggle. It's a struggle when it happens, and I think identifying the issue and getting help for it is really important as a first step.
Absolutely. And the last tip is to keep up with self-care even when you're feeling good. Now, this one also hits very home to me because I have been in my recovery process for about a year now. I felt like I was on top of the world. I am doing great. And then one day I ended up hitting a brick wall and I had an anxiety attack that I hadn't had in quite some time. And it was all because I had so much going on in so little time. And it felt like I was right back to where I started with this pandemic. And I ended up calling up my therapist and I was like, I don't know what to do. I'm having another panic attack. And it's been so long since this has happened. They ended up having to talk me off of a ledge. They ended up having me go through an entire list of everything that I was stressed about and nervous about. Told me to take a couple of deep breaths, exactly what I did. And then we ended up digging into the problem, which there wasn't a problem. I was just overthinking the fact that I had so much stuff, but they were good things that were coming to it. So what ended up happening was I was stressing out because I have probably about 3 or 4 more programs of this that I'm going to be presenting. One of them had FEMA involved, which I don't know how FEMA had gotten a hold of this program, but they did, and they sat through it, and I was really scared as I wanted to be good, and turns out it was great. I have my graduation around the corner, which I was stressing out because I was trying to get a hotel room, and was I going to get a hotel room in time? But I did, and so I ended up marking that off the list. My cap and gown, I wasn't sure if I was going to get it in time, but I reached out to them and it was good. So it was another check off. Okay, I was just overthinking everything. I had to take things step by step, but it all turned out to be fine. I was just
And
overthinking.
those are major things. I mean,
I
none of
know.
those issues on the list are minor issues. Those are major life events.
Yeah, I was not okay, but talking to my therapist and having them calm me down and say, listen, you're going to go through this program. You know it best. They are there to sit through and listen to it. You're okay. Had to hear. It's like I had to hear it type situation. It's like I lost all of my self-care, but then I got brought back down, and that was what I needed.
Yeah, and you know, your story sounds so terrifying and but so relatable. I think it could happen to anyone. I mean, any one of us could be in that situation. And it's the way you describe it, I feel like, yeah, that could happen to me tomorrow. Like these things just like happen to any person. And
Yeah.
especially when you're in EMS or medicine, first responder, you can slip into this situation really quickly. It can happen to any of us. And then like you're stuck. What do you do? And I love the way you described, like you were in a place where you were stuck, but you found the way to identify that you had the issue and get the help and climb out of it and
Yeah.
get yourself a plan, put a pause on what you were doing. It sounds like you stopped for a while and you're like, hey, I need to stop. What I'm doing is just not working. I need to stop, take time for myself and change my system. And it's amazing. And I'm so happy that it sounds so terrifying, but I'm so happy that you came out of it and stronger, and you're able to teach everyone, and you're able to teach us about this kind of situation in such a, a humanistic way. And it's really touching. I mean, I'm so happy that you're able to teach this program and kind of spread the word, because I feel this is something that everyone in EMS should be exposed to, because we just all go through it in one way or another, different levels, different extents, but we're all going through it. So this is really useful, I think.
Thank you. I think the crazy part is, just to touch base back of what you were saying, is that everyone has a way of hiding their symptoms, has a way of hiding their true feelings. I know if I ended up talking to any one of my coworkers, they had not a single clue what I was really going through.
Yeah.
And I could have just been, I was just really good at faking it. I don't know. But, if I was able to do it and I fooled all of my coworkers, what's to say that you wouldn't be able to fool all of your coworkers, or one of your colleagues is able to fool everybody else? So that's why it's really important to do a really deep dive for an individual to do it on themselves, which would actually go perfect with this self-care assessment, and to realize, are these things that I'm able to do? Are these things that I'm hiding? Are these feelings real? And it's
Yeah,
just,
I mean, we're all so good at putting on our professional face,
Yep.
The fake it until you make it. You
Yep.
finish paramedic school and you feel like you're invincible, and then but you have to fake until you make it, until you get experience and kind of know what you're doing. And we all go through that. Same thing with medicine. You finish med school or residency and you're like, oh, I don't know what I'm doing, but you fake it until you make it. You start
Exactly.
you just do stuff, and there's always that feeling of I'm kind of tricking everyone and I don't really know what I'm doing, but I'm kind of acting like I know what I'm doing. That impostor syndrome going on, and it happens in medicine, it happens in EMS, parts of medicine. I think especially it can happen to all of us. So that
Exactly.
imposter syndrome, that holding the professional face and no one really knows what you're thinking or what's going on behind the scenes, is something that we're all very good at. And that's why self-assessment and self-care is really important, because, we should all be straight with ourselves and kind of be able to, even if we don't tell anyone else, we should be able to look into ourselves, see what issues we have, and do that stop and do that care plan. Even if it's small steps, it sounds like even small steps sometimes can make a big difference.
Absolutely. Which is where the self-care assessment comes into play. This is actually one of the self-care assessments that I took for myself before getting back into work. This is a psychological and emotional self-care. Now, psychological and emotional self-care assessment. This does have extra sections to it, where there would be one for physical, spiritual, emotional, and professional, physical and professional. I just did the emotional aspect, especially since this is for compassion fatigue. Now, what I'm going to have you do is I'm going to have you take a nice look at these examples, and you're going to check off: 1, if you do it poorly or you do it rarely to not at all; 2, if you do this okay, or I do this sometimes; 3, I do this well and I do this often; or a star, which you would just be marking off the little star box and saying, I would like to improve this, or I would like to do this more frequently. I have no problem reading through them. But this is, again, for you to be taking a little bit of a self-care assessment for yourself, for just this psychological and emotional part. So taking time off from work, school, and other obligations.
I think
Participate.
I do this okay.
Okay, that'd be 2. Participate in hobbies.
I do this poorly.
Okay. Get away from distractions such as phone, email.
Oh, I do that so poorly.
Learn new things unrelated to work or school.
I do that really poorly. You kind of get into your field in medicine, and I spent so much time, so many years concentrating, passing my boards, my in-service, my second set of boards, that it's hard to learn anything different. I think now I'm finally at a place that I pass my boards, both sets of boards, and I can learn something new without worrying about like, oh my God, I have the boards to pass. But then I just don't do it. So that's definitely something I'm going to put a star at. I would like to learn different stuff.
Okay. Express my feelings in a healthy way, such as talking, creating art, journaling.
Oh, I do that poorly.
Recognize my own strengths and achievements.
Poorly.
Go on vacation or day trips.
I'm going to put a star next to that. I want to do better on that.
Okay. Do something comfortable or comforting, such as rewatch a favorite movie or take a long bath.
I do that poorly.
Find reasons to laugh.
Oh, I do that poorly.
Talk about my problems.
Definitely poorly.
And your overall psychological and emotional self-care, or all of those, a summary of all of those.
I think all in all, I'm going to put a 1 there, but also a star because, you know, after this talk, I really recognize the need to do better on that.
Yep. This is actually the perfect tool to use to pick the things that have a star or things that you want to focus on, and that would be the start of your self-care plan. That would be the very beginning. So I'm just going to use the example of go on vacations or day trips. That's something that we were discussing prior. You know, obviously you weren't able to go flying before, but now if you don't want to go flying because you feel that work is too overloading, take a less step and do something local. If you can't do that yet, then try just going to a park for about 10 minutes or so. Just that you got to take baby steps. That's one of the big things when it comes down to self-care, is that it's baby steps. There is no magic pill. There is nothing that's going to make this just disappear. There is no, I'm going to snap my fingers and boom, I'm cured and my self-care assessment is beautiful. There is none of that. It's, you have to put in that work also. So we always like to go through doing a time, a place, where you're going to go, how long are you going to do it for, and you're going to try to hold yourself accountable for it, even if it's, you know, putting a reminder on your phone, you know, every Tuesday from this time to this time for only 10 minutes, I'm going to walk to the park. If you can't walk to the park because it's raining, what's the next thing that you would be able to do? You know, whether it's reading a book or working on something else on here that has a star that doesn't require you to go outside. So that way you're still putting yourself first and you're still working on yourself, especially with one of these psychological or emotional self-cares. But it's also, you know, if you can't do one, then you're working on something else, which is exactly why it's always important to try to complete the full self-assessment of physical, emotional, professional, spiritual. I can't remember. I think that was all of them. So that way, if you can't do one, you can work on the other, and you're just a well-rounded person, and you're working on yourself in every capacity possible. And it's not just, oh, I'm okay emotionally, but physically, I'm like, nah. Or professionally, I'm still going to be a mess. You know, we want to work on everything collectively.
I love the fact that, you know, you say, because like I just can't get on a plane and go now internationally because of COVID probably, you know, and because of my work. So just doing that small step, hey, maybe I could take a day trip to Philadelphia. I don't know, or New York. A small step, or even going to the park. You know, I have a park nearby. So doing those small steps, I think I can. It sounds doable. I mean, I think I could find a small step that I can do, even if it's a very small step. Take a walk in my neighborhood. We can all find something small that we can do that's just like, I can find the strength to do that. And a lot of times it's just finding the strength to do even that small little thing. And, you know, the big thing is out of the question. There's no way I'm going to be able to do it. But the small thing, I do feel from what you're saying that I could find the strength to do something small in all these different aspects of my well-being.
Yep. It's almost like, you know, you're set in a routine of coming home, going to work, coming home, going to work. You know, you want to make this part of your routine. The first week it's going to be really weird because, you know, this is something that you're just throwing into it and you have to get all used to it all over again. You know, now I'm going to be adding a walk before I go to work or after I go to work, but I'm tired. I really don't want to. It's really easy to make up those excuses to just say, I'll do it tomorrow. But then tomorrow comes, I'll do it tomorrow. And then that's the perfect way for your self-care to just go straight back down to the tubes. And that's why we want to start off with the small goals, things that we can see achievable, things that, you know, we don't want it to be something where you're going to say, oh, I'm going to do this every day. So then that way, the second that you miss it, you just feel, oh, I'm a failure. I already messed up. I can't do it every single day. You know, start off with, I'm going to walk once a week. I'm going to walk around my neighborhood once a week on this day at this time. And set a reminder and then see how you feel the following week. If you say, you know what, I felt great after that and you want to up it to twice a week, do that. There's no problem with doing that at all. And that's something that is very hard for people to, again, start getting into the habit of. Everyone wants to just shoot really high, as we were saying before. Everyone just wants to be the best of the best. But when it comes down to this, you have to take those baby steps, because once you start going up higher and higher, it's just going to get so much easier for you. Like, wow, I should have been doing this for such a long time. I don't know why I didn't. It was so easy to get started.
That makes a lot of sense.
So now self-care and EMS. I feel like that this would be very, very challenging. I mean, you could probably tell me a little bit more about this, but how are the shifts? How long are the shifts?
You know, it changes from EMS, between EMS agencies, but self-care in EMS is an especially challenging thing. I can tell you, you know, I finished paramedic school over 20 years ago, and that's where I learned to eat fast, because if you got your food, you had to eat it as fast as you could before you got your next call. And the rule of thumb is you always get a really challenging call right when you start eating your food. So you learn to eat fast, and that's just the start of it. It's shift work, and you work days, you work nights, you work weekends, you work holidays. And shift work is especially challenging to take good self-care, because you don't have a routine. It's always changing around. It's a very stressful environment. As you can imagine, you know, in EMS, it's life and death. You can't make mistakes, or at least you feel you can't make mistakes. If you make a mistake, it could cost someone their life. So it's a very high stress environment. Of course, COVID added on an additional layer of stress. Am I going to get COVID? My patients don't want to wear a mask suddenly, or the family member don't want to wear a mask, or my partner doesn't want to wear a mask. And I'm going into the hospital where a lot of people have COVID. Am I going to get COVID? Is the vaccine going to protect me? There's just like so much stress around COVID that added to an already really stressful environment. And many, you know, EMS, none of us are in EMS for the pay. You know, EMS is not a well-paying job. People do EMS because they can't, they have to. It's a calling. And many of our EMS providers work multiple jobs because the pay is not there. And people have to work multiple jobs to make a good living. So people are overworked. Some people are going from shift to shift. They finish a shift one place, and then they're going to the next EMS agency to work another shift. So there's just no break. So EMS is a very challenging environment to take care of yourself, all in all. So I'm curious to hear what your thoughts on that.
I do have tips, don't worry. Have some tips to prevent some compassion fatigue, especially when you are working in EMS. And everything that you had explained just was a lot. And you know what? I can honestly only imagine working one shift and then leaving that job to then go to another job to then work another shift just as long, if not longer. It would be a lot. Having the shift work where, you know, you could be working mornings or you could be working nights. So your sleep is going to be all crazy. These are just a couple of tips to help prevent compassion fatigue. They all might not work. They, you know, some of them might fit others better than some of the other ones. So, you know, if someone's got one job, you know, prioritizing your sleep might be the best, or getting professional advice might be another, might help for somebody else. Now, when you're prioritizing your sleep and recovery, both paramedics and EMS, you know, you work very long very long shifts, so it can be challenging to get some regular sleep. So you want to try to create a bedtime routine. You want to avoid caffeine, alcohol, and other substances that can keep you awake. And you even want to try to find a calming ritual that helps you sleep. It could be essential oils, it could be candles, it could, listen to calming music. I know when I was younger, the sound of the waves put me to sleep like no other. I mean, I could do that now and I am down for the count. It could just be something simple like that. And, just start incorporating that into your routine. Come home from work, I'm super stressed. Let me listen to the sound of the waves, or let me listen to nature. It sounds cheesy, but it works. And it's exactly what you want. You want your mind to just relax and almost turn off from being in that overdrive mode of work, 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 to I'm now home. I am trying to put myself first. I am calm. I'm cool. I'm collected. I need to recover myself. I need to rest. Get adequate nutrition and physical activity. Physical activity and nutrition can have loads of benefits to protecting your overall wellness, and even a workout routine might offer an outlet to relieve some stress. So I totally understand that this can be extremely hard, especially if you're going from one shift to the next shift or anything of the sort. You can try your best to, pack an apple as a snack, pack your lunches rather than, doing that option of McDonald's is right around the corner. Let me just get that because it's quick, easy, and effective. There are certain bars, like there's nutrition bars, there's nuts, there's fruit. They're feeding your mind for one, and two, they are going to hold you over for that shift work. And, you're not going to feel really crummy and sluggish after eating an apple the way that you would after you just ate a Big Mac from McDonald's or something like that. Physical activity, again, you can incorporate that with your self-care plan. Whenever you come home, take a 10-minute walk. That 10-minute walk will do you wonders. It's your way of turning your mind off from work, and I'm cool, calm, and collected all over again. I am away from work. I'm doing this for myself. Meditate. People who meditate experience more compassionate responses to traumatic images and sounds with less anxiety. This means meditation can be a powerful tool to EMS and paramedics who want to strengthen their defense against compassion fatigue. I personally I'm not very familiar with meditation. I have tried it. I just didn't feel like it was a good fit for me. However, anybody else, if you have done it, they've told me wonders about it. They tell me that it's a way for them to kind of disconnect from the world and just know like this is happening, but it's not happening to themselves, if that makes sense.
Absolutely. Absolutely. And if it works for whoever it works for, I hear from people too that it works great.
Mm-hmm.
Doesn't work for everyone, but if it works for an individual, they should definitely try it.
Absolutely. They also have apps that you can just download on your phone and, just follow along with it. They'll have the music, they'll have someone speaking to you. It's quite easy. You could do this in your home. You could do this on a break. Meditation doesn't have to be hours at a time. It could be something small and short. You can rely on your peers and peer counselors. Many EMS agencies have peer support teams where individuals can receive trainings to recognize emotional and behavioral issues, from depression to drug misuse, so they can guide their colleagues to a network of resources. Is this something that you guys have by chance?
Yeah, we have a bunch of resources, and I'll actually, at the end of the talk, I'll put up a slide with local Penn State resources, county resources in Pennsylvania, and also some national resources for people outside of the state.
Perfect. That's exactly what we're going for. Get professional advice. Speaking with mental health professional isn't just for emergencies. Anybody can benefit from therapy. Now, this is something that, again, I hold near and dear to myself because this is actually something that I ended up doing. I ended up getting that professional advice. They ended up telling me, listen, you need to take a couple steps back from a couple of things. You need to start working on yourself first, and you need to put yourself first. It was a hard pill to swallow. It was very hard to get started, but I couldn't be happier at the fact that I did. I didn't realize how troubled I was until I had someone in front of me letting me know, you're doing this, you're doing this, you're doing this. You have a lot on your plate. You are biting off a lot more than you can be chewing right now. And hearing it from somebody else, as weird as it may sound, kind of clicks in your head a little bit more than if I were to tell myself, because then I'm just like, no, I'm just second guessing myself. Or if I have a peer telling me, I'm like, no, like they're just my friend. They're just trying to say that. But if it's coming from a perfect stranger, it seems to just be like, oh, okay. I really probably should take a step back because they don't really know me the way that I would know myself or my colleagues know myself. And they're telling me that there's something going on, then there really must be something going on. Another thing that before we go on to the last one of create a plan of when you are seeking for a therapist, is never going to be like a one and done type situation. If you feel that you can't make yourself extremely vulnerable with that person that you are sitting, that is your therapist, or that you want to be a professional, your professional therapist, if you aren't being vulnerable, it's probably not a good match. Something that they don't really ever tell you is that a lot of people just think, oh, well, this person is on my insurance plan. I'll get into it. I'll eventually tell them everything. If it's your first session and you can't be completely honest with them, it's probably not a good match. There's no harm in that. A lot of therapists should be telling you that, especially on session 1. But if they don't, that's something to always keep in the back of your mind. I know I probably had to go through at least 4 therapists before I got to where I am now. It was a trial and error, on the first day, I was just like, something seems a little off. Let me try a little bit more. I did try a little bit more. I still didn't feel it. I didn't feel that connection the way that I do now, where, I could just call up my therapist and be like, it's happening again. And they can just talk me off of that ledge. So that's always something really important and something to keep in the back of your mind, especially if you are planning on looking for someone. And the last one is to create a plan. Creating your own coping self-plan or skills plan. This goes along with the idea that everyone will have a different preferred way to cope, depending on the type of stressful situation they've experienced. Creating a plan can help you pause, identify the level of stress you're having, and have some go-to coping strategies. This is actually something that I ended up learning throughout my entire recovery process as well. Depending on the situation, depending on how severe, so my example from previous, where I was having an anxiety attack about all the different things that I had, I tried my other techniques, which were breathing techniques, which take a walk around the building and take some deep breaths, listening to some music that I find very calming, which, as weird as it is, it's country music. I love country music. It just takes me away. And none of that was working. So then that's when it ultimately came to, let me call my therapist right now, because all of my other strategies aren't happening or aren't working. So I ended up doing that, and that was what helped me. The fact that I did end up going through those other 3 first was what made me realize, this is different. This is something where my other 3 strategies aren't working for me. So I had to have a 4th one. Everybody's coping strategies are going to be different. It could be deep breathing. It could be, let me go into a break room and let me meditate for about 10 minutes just so I can release everything that just happened. It could be listening to music. It could be anything. Everybody's coping strategies will always be different. So I actually do have like a little tip sheet on how to cope with anger and anxiety, especially in the workplace. And it does actually give you some suggestions on things that you can do to help with these strategies. The last portion of this would be just some words of advice, which would be, don't make some big decisions, especially if you are, in the thick of feeling compassion fatigue. That would mean, don't go looking for a new job just because you feel like, oh, I can't right here. They're not helping me out. We're in this pandemic. We've been in this pandemic. Nothing is changing. Don't do it. Once you do it, you can't undo it. And you're doing that just because you are feeling a certain way where you need to work on yourself first. Don't blame others. It's not going to help at the end of the day. It might be a temporary, like, I'm going to blame you just for the time being, or I'm going to blame you that this happened to so-and-so. At the end of the day, you're still going to be thinking about it. You're going to hold on to it. And that's also just going to be another reason as to why you still have that compassion fatigue. Don't spend your energy complaining, and don't try to do a quick fix. The quick fixes are usually like alcohol or substance abuse, overeating. A lot of the time people will always joke, especially at my job right now, is, oh, I'm just going to drink my feelings. Something we don't want to do. You might be joking, and a lot of people always end up taking it as a joke, but a lot of the times the person that's saying it might actually mean it. Like, yeah, I'm just going to go home and I'm going to go drink my feelings. We don't want to do that. I know another big thing, especially during the pandemic, is I'm going to go eat my feelings. That was actually something that a lot of people did, which also resulted in our pandemic pounds, something that we would like to cut back.
Yeah, and I always wonder about the complaining. I mean, for a long time, I thought that complaining was just a waste of my energy. But then I realized some people like complain to let things out, and and kind of like it's cathartic to them. But then I'm like kind of on the fence on on the complaining. I never know. I'm not a big complainer myself, but I've over time I've recognized that for some people complaining is kind of like therapeutic. So I think it really depends.
Yes, it does depend. There's healthy complaining, and then there's non-healthy complaining. A perfect example of that would be, if I'm complaining about a situation that ended up happening at work with you, saying how, oh my gosh, I can't believe, like this pandemic is still going on. I can't believe we still have to wear these masks. And then you chime in and you're like, oh my gosh, I know, I can't stand it either. And we both kind of are venting about the exact same thing, and we both end up getting more angry at the end of the conversation. It's almost like we're feeding fuel to each other's fire to an extent. That's the type of complaining that we don't want to happen, because now I started off okay, where I just thought I can just vent to you in the lethargic way, and now I'm leaving this conversation even more angry, thinking about that topic even more. And that's not the route that we want to go down. And, that's something that they always end up saying, choose who you're going to vent to or complain to wisely. If you're going to go to a coworker and you know that they're going to get just as amped up about that topic as much as you are, don't go to them. You might feel better off actually just journaling or writing down everything on how you feel. A lot of people always overlook journaling because they're just like, oh, it's journaling. That's so stupid. Like that's something that people do in elementary school. It's actually something that I've been trying to get back into. Just the feeling that you're writing everything that's on your mind onto a piece of paper. You can take it out on that pen and paper, how angry you really are, and you will see it later on. But it's more the fact that you're getting all of those emotions out right then and there, and then the second you close it, as weird as it sounds, but you feel instantly better. You got everything that you wanted to say out. It was on pen and paper. It may not have been to a person, but you got it out. Like, it's one of those, it's out of my systems. That's it. It's done. It's over with. I'll look at it later. Some people even have the tendency of writing down everything that makes them angry, crimpling it up and either throwing it away or watching it burn in a fire or something like that, just as a way of just saying, it's off. It's done. It's out of my system. It's gone. And that's something that's like another way of, you're complaining to your journal, not necessarily somebody who's going to feel your fire, but going out there. You could even talk to a director or what is it? Some places have employee assistant programs. Mm-hmm. If you felt comfortable enough talking to someone there. But a lot of the times people do obviously like talking to someone that can relate to the experience, which is why they always go to a colleague. It's always important, though, to make sure that it's a healthy complaining. Some additional resources that we ended up finding on New Jersey side is Heal New Jersey healthcare workers. We do end up having, it's a Heal healthcare workers. They actually do have recorded sessions online. One of them is, what is it called again? It's called the skill of chill, the importance of relaxation and self-care. Everything is pre-recorded. So it's just more of a, click on it at your leisure time. They do have additional videos, but that was just one of them. I mean, it's focusing on the physical wellness, relation to sleep hygiene, and how to truly recharge during these unprecedented times, COVID. The other one is Rise First Responders. They also have pre-recorded programs. One of them is called Resilience, and it's using mental health or using mental games. And it's using mental games to avoid thinking traps and to keep our minds agile about everything that's going on.
Oh, there's a slide about the graduate education in public health preparedness at Penn State.
Yes.
And thank you for the public health preparedness program for hosting this talk on the website. Hopefully it allows access to a lot of different EMS providers to watch this talk and learn about it. And
Yes.
congratulations for being a few days away from graduating from the Master's of Professional Studies.
Thank you.
That's exciting.
It is. And this is just my contact information, your contact information. But thank you again for having me. I really appreciate it. I hope you got some tips out of this. If you need me to send anything, by all means, let me know. I'm here. So.
Absolutely. Thank you very much for sharing your experience. You shared it in a very vulnerable way, a very personal way. And I think it really speaks to a lot of people. I mean, it shows that this can happen to any one of us. And we all need to be able to cope with this kind of stuff that's happening. We started out with a really tough environment in EMS, and it only got worse with COVID. So taking that step back and being able to self-assess and make those small first steps to intervene and help ourselves are huge. And from this talk, I take away a lot. I know what compassion fatigue is. I know what I can do to assess if I have compassion fatigue, which I definitely do based on my assessment. And I also know what I can do to help myself with it. Those few small steps that I make a star next to it. I'm like, yeah, I could probably do something small here and there in these fields and make it a little better and help myself grow in that situation. And when it gives me, it's self-empowering. It gives me the power to take care of myself, and I don't have to, rely on all the surrounding environments that are, stressors to do this for me. I can do it for myself.
Yeah. Excellent.
And I did want to share one slide with some additional resources. If you stop I think if you take down the slides, I can put up the one slide for national resources. There you go. Thank you.
Mm-hmm.
Let's see. Share screen. There we go. Can you see the screen?
Yep.
Perfect. So these are some resources for Penn State Health, for Pennsylvania, for different counties that have helplines, and then national helplines. There's the Suicide Prevention Hotline, the I'm Alive Hotline, Safe Call Now, Fire EMS Helpline, and National Text Message Service. So a lot of different resources where you can get help. There's the Code Green campaign, which is geared towards EMS providers and mental health help. So there's a lot of resources out there, and in different EMS agencies, there are different additional resources that you can get to get help with this kind of stuff. And definitely, I'd encourage everyone to get the help you need.
I was just going to add in that I also did notice that you also have the Employee Assistance Program,
yes,
which is also a great tool to utilize.
Yes, absolutely. And many health systems and EMS services have that kind of program. So definitely take advantage of it and seek help in, with those programs.
Awesome. All really great.
Yeah. Well, thank you so much for giving this talk. This is and I think this talk is seeked out all around the country because it's such an important talk and so helpful. It's not one of these talks where people are like, well, you have a problem, but I don't have a solution. It's like you can recognize, each one of us can recognize issues we have with ourselves. And then we also have solutions of what to do about it. And that's what's great about this talk. And I hope that our EMS providers can watch this talk, identify issues, and we all have issues with it. You know, I mean, for me, it was everything, and for a lot of people, it's everything. Some of the people watching it may be only, you know, a few things, but putting in those numbers and the stars and identifying the things that you can do better and that the small things you want to start with is a good way to go and a good place to start. So, you know, I would like to wish everyone a happy EMS week, which is coming up. And thank you again for giving this talk.
Of course. Thank you so much for having me.
Yeah. Have a good week.
Thank you. You too.
All right. Have a good one. Thank you very much.
Thank you. You as well.